We are also watching how our less populated areas are doing when it comes to the coronavirus. I checked in with a clinic in Warren County where there is no hospital. I first met Dr. Damara Russell in February. She'd come back to her hometown of Warrenton to open New Hope Regional Medical Clinic. She's one of only a few doctors in all of Warren County where there is no hospital. I checked back in with Dr. Russell Monday to see how her practice is doing since the global outbreak of coronavirus.
Well, the main thing that we have changed is that patients who are symptomatic from upper respiratory illness with things such as fever, cough, shortness of breath, we're now asking them to call our office prior to coming for evaluation so that we can kind of direct them as to how we think we need to best triage and evaluate them.
As of yet, Warren County has had no confirmed cases. What would you do if someone called and said, these are my symptoms? Do you think on your end as a physician that those are symptoms that are emblematic of coronavirus or COVID-19? What's the next protocol?
Self-isolating for a minimum of 7 days. And if they are symptomatic with like fever, cough, shortness of breath, we're asking them to self-isolate for a minimum of 7 days, plus 72 hours past the time that they are no longer having a fever without medicines to help reduce fevers.
But if those symptoms become more severe, that's when Dr. Russell says they have to get treatment. So what would they do then? Would they come to you or would they go over to Vance County to the hospital? Well,
the way that we are doing it here, because we don't have resources in the county to help those patients, if they're having moderately severe or severe symptoms, we're going to ask them to go to the emergency room. And I can't speak for my counterparts, but I think just because we don't have a hospital nearby, that's the safest management for the patient.
New Hope does have a few tests Dr. Russell got from a private lab, and she says she can get more of them if needed. How are you guys faring at this point in terms of other medical supplies like face masks and gloves?
Well, we are doing okay just because we have not encountered the numbers that other places have encountered as far as needing to screen for this. I can say that some of my counterparts that I have been in contact with are in desperate need of supplies.
What's your message for folks who live out in the community and are very nervous?
Try not to be fearful. Do the things that are asked of you. Wash your hands, stay away from sick people, stay home as much as possible. And if we can do these things, I think that we will flatten the curve,
And Dr. Russell certainly showing that positivity from herself. She's encouraging everyone in the community to do the same. Just follow the guidelines. Wes?